Hello everyone, this is Alraies and this is SIF 2021. With me is Dr. Manish Parikh. He is the Chief of Cardiology at New York Presbyterian Brooklyn Methodist Hospital. Dr. Parikh, welcome to the SIF 2021. Nice to see you in person.
Well, thank you.
Yeah.
Having lived in a virtual world for about a year, it's nice to be out.
Yes.
All of us have been vaccinated. We're in a safe environment.
Absolutely.
And it's really nice to re-engage with friends and colleagues.
Finally. Dr. Parikh, given you are a great teacher, educator, what do you think the impact of COVID pandemic has done on the education of fellows?
Yeah, that's a great question, and we've thought about it quite a bit. With two waves of pandemic, of course, we were hit very hard in New York.
Yes.
We were the first in the country. We were essentially shut down in March, April, May, and we were all deployed, taking care of very sick COVID patients. I have to tell you that the heroes are our fellows who took over a lot of our ICUs and CCUs, and I think that they learned and grew in many other ways. But clearly, interventional training, like all fellows training, was impacted greatly in the last year.
Absolutely.
What we have tried to do, and what many programs are doing throughout the country, is to make up for lost time with adjunctive, supportive teaching. So, case-based teaching, essentially Zoom-based reviews. We still have had CATH conference that we have not missed. We continued our didactics despite the pandemic. We tried to re-engage fellows by really doing case libraries, case scenarios, so that at least the conceptual part of interventional cardiology was maintained.
Exactly.
Certainly, nothing is the same as being in the lab and wiring your own lesions and putting stents in. But in a situation where we were, everybody understood that that was the case. Having said that, I think we're starting to catch up. This year we have done very well with our volume numbers for our fellows. Both of my current interventional fellows have met their volume needs already, despite the second wave. But more importantly, what we want to do and what we are doing is partnering with our industry partners and our educational institutions to say, what will we offer our fellows as they leave and graduate if they feel that they're not ready?
Absolutely.
What are the resources? There are many things I can tell you that we are in the works of doing. Number one, all of the companies will have online didactic exposure and experiences. Many of the companies are ready to support proctorships where people will come into the lab if you are perhaps needing support for complex cases. And I think what is now clear in the Zoom world that we live in is that virtual ability for people to be in your lab and supervise is here to stay.
Exactly.
So that I think that if we utilize what we've learned through the pandemic to better educate, I think that we're going to do very, very well. And I think we just have to stay positive.
Absolutely. We learn new toolkits now that are available for education. Right. How about the practice and how to create that funnel of referrals from different institutions or providers to the hospital? How you can maintain that, or how would you learn during that experience to keep it going in your lab?
I think the thing to remember for all of us is that the patients aren't going away. The patients may be afraid to come in.
Yes.
They may be postponed. They may be delayed. Unfortunately, I know we did have some patients who have expired because of either COVID or staying at home. But our referring doctors, our patients understand that we are available. And I think what we need to do is be supportive, make sure that people get vaccinated and come back out. And when they need us, is to be able to provide the care they desire. The toughest problem now is finding appropriate bed allocations in the hospitals, because many of the CCUs and ICUs are still clogged with COVID patients.
Yeah.
I think we're working through those challenges, but I think what we should know is the pathology didn't go away. Many times it may be waiting for us to treat. Hopefully these patients will not have acute coronary syndromes, but we will be back. We will continue to innovate and continue to educate, and we will continue to take care of our patients.
And keep the ship going, absolutely. Dr. Parikh, thank you so much for your time and your thoughtful ideas and experience that you had during COVID in the pandemic area of New York. Appreciate your time. Please watch this video and others on SIF YouTube channel. This is Alraies from SIF 2021. Thank you, Dr. Parikh.
Thank you very much.